Good day, I'm Randan M. Pangilinan, student nurse from BSN 3A, and in this video, I will discuss the Glasgow Coma scale. But first, let me give you a brief introduction. The scale was published in 1974 by Graham Tisdale and Brian J. Jennett, professors of neurosurgery at the University of Glasgow's Institute of Neurological Sciences at the city's Southern General Hospital. On the other hand, a patient is assessed against the criteria of the scale, and the resulting points give a patient score between 3, indicating deep unconsciousness, to 15, full consciousness. What is GCS? The Glasgow Coma Scale or GCS is a neurological scale which aims to give a reliable way of recording the conscious state of a person. It is the most common scoring system used to describe the level of consciousness in a person following a traumatic brain injury. Basically, it is used to help gauge the severity of an acute brain injury. The test is simple, reliable, and correlates well with outcome following severe brain injury. So the Glasgow Coma Scale is based on 3 patient responses, which is the eye response, verbal response, and motor response. Now, how you can remember this? Glasgow Coma Scale. We're looking at the eyes, the mouth, and the motor response. So we will look at their eyes, look at their verbal response, and we will look at their motor response. And we give them a score. Then add them together, and that is their total Glasgow Coma Scale score. For the scale scoring in eye response, there are 4 grades starting with the most severe. First is no response or no eye opening, which is 1 point. Next is to pain, eye opening in response to pain stimulus. A peripheral pain stimulus such as squeezing the lunula area of the patient's fingernails is more effective than a central stimulus such as a trapezius squeeze due to a grimacing effect, which is 2 points. Next is to verbal command, eye opening to speech, not to be confused with the awakening of a sleeping person. Such patients receive a score of 4, not 3, which is 3 points. Then lastly is spontaneous, eyes opening spontaneously, which is 4 points. Then in verbal response, there are 5 grades starting with the most severe. First is no verbal response, which is 1 point. Next is incoherent or incomprehensible sounds, moaning but no words, which is 2 points. Next is inappropriate words, random or exclamatory articulated speech but no conversational exchange, speaks words but no sentences, which is 3 points. The next is confused. The patient responds to question coherently, but there is some disorientation and confusion, which is 4 points. Then lastly is oriented. Patient responds coherently and appropriately to questions such as the patient's name and age, where they are and why, the year and month, which is 5 points. Then, in motor response, first, no motor response, which is 1 point. Next is extension or decerebrate posturing accentuated by pain. Extensor responses including adduction of arm, internal rotation of shoulder, pronation of forearm, and extension at elbow. Flexion of wrist and fingers, leg extension, and plantar flexion of foot, which is 2 points. The next is flexion or decorticate posturing accentuated by pain. Flexor response including internal rotation of shoulder, flexion of forearm and wrist with clenched fist, leg extension, and plantar flexion of foot, which is 3 points. Then next is withdrawal from pain. Absence of abnormal posturing such as unable to lift hand, past chin with supraorbital pain but does pull away when nail bed is pinched, which is 4 points. The next is localized pain. Purposeful movement towards painful stimuli For instance, brings hand up beyond chin when supraorbital pressure applied, which is 5 points. Then lastly is obeys verbal command. The patient does simple things as asked, which is 6 points. For the interpretation, to calculate a patient's GCS, first score the patient on each of the 3 main areas. Once a number has been determined, add this to create the sum, which is the patient's Glasgow score. Once a score has been identified, it is important to understand the meaning. Generally, brain injury is classified as severe, with a GCS score of 3 to 8. A score less than 8 usually indicates a coma. Now, that's really bad sign. So a score of 8 indicates coma. That means that the patient probably can't breathe on their own. So they are going to have to be intubated, where we put a special tube in their mouth and down into their airway, and we connect them to a mechanical ventilator. Then next is moderate, with a GCS score of 9 to 12. Moderate brain injuries often result in long-term impairments in cognition or thinking skills, physical skills, and or emotional and behavioral functioning. Then lastly is mild, with a GCS score of 13 to 15. Mild brain injuries can result in temporary or permanent neurological symptoms, and neuroimaging tests such as CT scan or MRI may or may not show evidence of any damage. Now, it has a range from 3 to 15. Well, that should make sense because if you add up, if you gave them a 1, 1 and a 1, they would be dead. But if you gave them a 1, 1 and a 1, that would be a score of 3. If we added 4, 5 and 6 together, that would be 15. So when we say 3 to 15, that kind of gives you an idea and a reference of what we're talking about. The higher the number, the better. While the Glasgow Coma Scale is a great diagnostic tool, there are multiple limitations that can alter the score and not provide an accurate picture of the patient's brain injury. These include tracheal intubation and severe facial or eye swelling or damage make it impossible to test the verbal and eye responses. In these circumstances, the score is given as 1 with a modifier attached. For instance, E1C where C means close and B1T where T means tube. Often the 1 is left out, so the scale reads EC or BT. The GCS is usually not used with children, especially those too young to have a reliable language skills. The Pediatric Glasgow Coma Scale or PGCS, a modification of the scale used on adults, is used instead. The PGCS still uses the 3 tests, including the eye, verbal, and motor responses, and the 3 values are considered separately as well as together. When performing GCS, remember that factors such as drug use, alcohol intoxication, shock, or low blood oxygen can all affect a patient's level of consciousness. These factors could result in an accurate GCS score. That's all for Glasgow Coma Scale. Thank you for listening. Have a nice day!